There are at least 30 more cases in Kashmir Valley, right? People are more than scared. They're like petrified.
Actually, this coronavirus is belongs to a family of viruses which has been a very well-known family, right, from years past. Previously, if you look into the textbooks, medical textbooks, we will not fail to notice that two groups of viruses, predominantly two groups of viruses, the rhinovirus and the coronavirus, have been historically responsible for upper respiratory tract infections, which we call the common cold and the cough symptoms. And this time, it seems that this coronavirus, if at all this is coronavirus, it has undergone a mutation. Mutation is a sort of a modification in the character of the virus, this particular virus. And this modification in the character of the virus, which we call virulence in medical terminology, has given a sort of a power, we can say, to this virus to cause a serious illness in the patients who get infected with this virus. So this is this is a problem basically which we are facing right now, and this problem has happened all of a sudden because this is only a couple of months that this infection has been going on. So the data and the experience which is available to the medical fraternity and the scientists who are working on this coronavirus is still very small. So that is the problem which is complicating the whole issue.
And if yes, why did it spread like wildfire only in this year? I mean, there has to be something that triggered its spread. Like,
I have already answered that question. What happens? The viruses basically transform themselves. It's a sort of an evolution in the environment which happens exactly the same way as human beings transform over a period of time. They adapt to different circumstances. In the same way, this virus, in order to adapt to changing environment or changing circumstances, whether laboratory induced or nature induced, that is still under a big question mark, quote unquote. But the fact remains that this change, this adaptation, sometimes gives these viruses and microorganisms a capacity to invade human beings on a large scale and cause damage to the lungs of human beings on a large scale. That is the problem. Actually, this coronavirus, as I already said, does exist and has been existing there like other viruses in the environment. And it has been, as far as the old textbooks are concerned, it has been uh, responsible for causing respiratory tract infections or flu-like symptoms over a long period of time before this COVID-19 epidemic started.
pandemic goes to stage 3 from this stage, which is considered to be stage 2, will we be able to control this epidemic? I mean, do you think there will be a big toll of death?
You mean the epidemic or the pandemic situation which we are facing right now? In India, you think your question is that in India, we say this is only a stage 2 epidemic. It
Yes,
has
sir.
not yet gone into the stage 3 epidemic. That's what you mean by
Yes,
your question.
exactly.
Actually, it's very hard sometimes to categorize very clearly the stage 2 from stage 3. But if we look at the actions that the government is taking,
Yes, sir.
it is basically already a stage 3 epidemic, right?
Um,
Now, whatever the government is saying, there are some, maybe some political, government wants to be politically correct. That is there. But if we look at the actions that the government is performing, that conveys a sense that the epidemic is already in stage 3. Now, as far as your question concerning the deaths, the heavy toll of deaths will be there. Yes, it is predicted that there will be a heavy toll of deaths, but there is a caveat over here, because whatever we are doing, whatever information we have so far, it's very limited, it is sparse. The only history or the only experience which is being extrapolated this time throughout the world is the experience got from the Chinese management of the epidemic, right? And that is a very, I mean, sort of an experience which can be effective, or which may not be that effective. That the time is only going to decide. The future history will decide whether this containing the epidemic the way the Chinese did was the right approach or not. But keeping these things aside, let me say that whatever measures are being carried out this time throughout the world and in our country, these measures are basically based on models. Now, what is a model? Model is an abstraction or a mathematical abstraction of a process. Now, in models, these models, I can say it is a sort of changing the situation into a toy universe, right? You are trying to mathematically sort of depict or express what is happening in reality. There are biases,
okay.
there are insufficiencies, and there are problems with the models. Now, what the models predict, if we look at the models, which the statistical models, which are mathematical models, which are predicting right now, if we look at those models, then obviously we can expect, we can be fair to expect a heavy death toll because of the epidemic. But when anything plays out in the nature, it does not always follow a model, whatever model it is, right? It may be very, very intelligent model, but it doesn't, because of the very fact that since coronavirus has been present in the environment, there must be some trace of immunity in the population. Now, what I have been always stressing, and I will stress it again, is that there is a group or a population or a chunk of a population which is at an excessive risk of getting a serious disease, right? Since India as a country is a young country in the sense I say that the demographic, the pattern in India as well as in our state in Kashmir is that the youth, or the age group of 19 to 24, makes up a major chunk of the population. That is about 40 to 40% of the population. So it is expected that when the disease spreads, and it's going to spread and it's going to infect almost everybody, because this virus, any virus, for the sake of the argument, any virus, whether it be flu virus, rhinovirus, swine flu, or any other virus whosoever has been there in the environment, ultimately infects the whole population. And it is
Excuse
good.
me, sir, I'll come to that point later on. But I would like to move to who has a cold or a cough necessarily suffering from coronavirus.
No, it's not necessary, because there are many other viruses which cause flu-like symptoms, like flu virus, H1N1 virus, or rhinovirus. There are. But what is important is that any person who is having such symptoms should seek a medical advice. and he or she should provide a detailed history to the doctors or the healthcare staff who are going to take care of that patient.
All right.
So that's very important, that he or she has to come out honestly and try to recollect all the history about the travels
Mm-hmm.
here or there,
Mm-hmm.
contact with the previous cases or suspected cases, right?
Mm-hmm.
So in that case, if the history suggests that a particular person who has the symptoms of flu or who has a running nose type of thing and who is having some cough, it's advisable that he or she should be regarded as a suspected case of coronavirus until proven otherwise.
All right, sir. Um, Now the next question: do you think that kids and people from the slum are more likely to be affected by COVID-19, or are the people like us who don't live in the slums, are they more likely to get affected by coronavirus?
No, it's not more likely or less likely. Actually, what the point is that everybody over a period of time ultimately is going to be infected by the
Yes.
coronavirus, by this virus. Ultimately, whether we accept it or we don't accept it, but this is the fact. We have to accept this bitter truth. But here we have to see that in the population there are two extremes of population. One is a population consisting of the children less than 1 year of age, and the population comprising the people or the citizens more than 60 or 65 years of age.
Mm-hmm.
So these two groups of the population at the extremes of the age
Mm-hmm.
are the groups actually who are very much prone to develop a serious illness.
Mm-hmm.
And that is the point of the that is the point I want to make. I want to just impress upon that it is the responsibility of the citizens, all the responsible
Mm-hmm.
citizens, to understand that these are the two extremes of population, and these two extremes of population have to be dealt with very cautiously. Precautions have to be taken to restrict them within the houses and restrict the contact with these two high risk groups of population.
But sir, what about those people who are living in the slums, who are more used to, dirty things? I would say. Um, are they? What about their immunity? If they get infected with COVID-19, are they more likely to die than we are?
No, it's not. It doesn't work that way. It doesn't work that way. Actually, it depends on the response, individual response of the human body. As far as the data are concerned, is that the population group which is covered within the age group, as I said, children more than 1 years of age up to 65. This group of people obviously are regarded as a group who are having actually a robust immunity. They can mount a robust immune response against this virus. But that does not mean that in this group of population there are some vulnerable patients. There have to be, because there are some patients who are immune compromised, who have some problems with the immune system right from the birth, or genetically, or in they have inherited some problems in the immune system. There are some groups even in this population who are regarded to be high risk groups. Now, people who are living in slums or people who are living in poverty stricken areas, it's not necessary that their immune response will be low. In fact, it can be the other way around. Now, if I don't know whether you have read Untouchable or not, but if you look at the novel, if you just that describes one day of a previously they were called the Harijans, 1 day of a Harijan or the untouchable. Now uh, they are, I mean, as far as hygiene is concerned, they don't have those basic, they don't follow the basic rules of hygiene, but they are going, they're living, and I mean the majority of these kids are quite healthy, quite healthy. Now that's another thing, that malnutrition is very much prevalent in this group of the people. Yes, that is true. And because the malnutrition is prevalent in this group, there are chances that this group of population may have a depressed immune response. They may be prone to mount a not an adequate immune response to this virus. That is a theoretical possibility, right? But that does not mean that everybody in the slums is a high risk uh, for this virus.
All right. Coming to the next question, is coronavirus in 2020 what the plague of Black Death was in the 14th century?
It is and it's not. It is in the sense that plague in 14th century was an epidemic, no doubt about that, and it took a heavy toll on human life. The estimates are about 175 to 200 million people have been killed by the plague at that time, and that amounts to about 20 crores of population. Heavy, I mean, whole chunks of population were wiped out. In that case, epidemics are epidemics, right? But there is a big difference between Black Death and the COVID-19 epidemic. Black Death was caused by a germ, which is called the plague germ, or the we call it Yersinia bacterium, right? And it has been found, and fortunately, the antibiotics and the drugs are available nowadays for that type of plague, that type of bacterial infections. But in 14th century, obviously there were no antibiotics, and it obviously took a heavy toll on the population. But at the same time, in 14th century, people did not even know how plague is transmitted from one person to another person, right? Transmissibility was a problem. Now, if you look at the COVID-19, again, there was a problem, which was very much similar to the Black Death, in the sense that we did not know about the transmissibility of this virus. Now, this is a virus that was a germ, bacterium, right? But this virus does not have a specific treatment as of now, and the plague germ did not have a specific treatment as of 14th century. But the problem with plague at that time was that the mode of transmission was also probably not known to the people. That's why it caused a heavy toll. People did not know how to handle it. This time, although we are not very much, 100% sure about it, but there are indications that there are indications that the transmission of this virus happens from person to person through contact and through air droplets. And also, it has been found that there are deposits, this virus gets deposited on the surfaces. So if we follow simple hygiene, and we have ample chances to control this disaster, to help out, at least, if not to control it fully, but at least to help ourselves to handle this disaster, right? That is there. And also the medical technology this time is, thankfully, it's very good developed to take care of the complicated disease. Now, Remember that virus per se does not kill. Virus per se does not, viral infection per se does not kill. What kills actually is the superadded infection and the complications which happen after this virus causes the disease in a human being. And those complications can be pretty well handled because there are reports that are patients do recover after this disease, but there are patients who are very high risk because of their own ailments who they were suffering from before this COVID, like respiratory tract infections, chronic respiratory, chronic lung diseases, chronic coughing, and other things, and so, heart diseases, and then diabetes and other things, which do put a heavy stress on the body. And then they are senior citizens. So those are the things which come into play. It's a very complex and intricate play of factors, right? So that is the difference between the plague epidemic of 14th century and COVID epidemic of 21st century.
All right. So if you were to say, if I were to ask you, who's at higher risk of infection, children or old age people? You would say old age people or children.
True.
So who basically is? Is it old age people who are like at a higher risk of infection, or children, 1 year old, a 1 year old kid, or maybe an 8 year old kid, or a 14-year-old kid?
No, actually, I answered this question before this question, but it's not the risk of infection. Everybody is at a risk of infection. It is what I was trying to tell you is the risk of getting a severe illness is a different thing. Severe illness and infection, these are two different things. Anybody and everybody over a period of time is going to be infected. But the problem is, which I want to just make clear, is severity of the illness. Now, severity of the illness is going to be very much alarming in the population group of more than 65 years age, and that group which is regarded as an infant group, right, up to 1 year of age. So these are the groups, these are the extremes, two extremes of age. They are prone to develop a severe disease. They are prone to develop a complicated disease. And this group of patients, these two groups of patients, are prone to have hospital admissions. They are prone to get sick, to require in hospital management, in hospital treatment, right?
This you had clarified before, but what I actually want to know is if who are like if a child of 1 year age gets infected with coronavirus, is that child more likely to be recovered? Is that child more likely to not die than old age people about 65 years of age are?
It's actually it's very difficult to say at this time that more likely or less likely. What is important this time is that these two groups are very high risk groups.
All right.
One may say that it is possible that they are more likely to die of the infection.
All right.
That's why I'm saying that these are the two target groups.
All right.
That's why we have to go for a triage type of a handling of this crisis. Triage was used in 19 in World War II, World War II, wherein the injuries were, I mean, classified depending upon the severity and the chances of survival. Because at that time also it was a crisis-like situation. People were just getting injured. People were getting not only injured, then they were getting infected of the injury, and some people were very sick, and some people were just not so sick. So at that time, this concept of triage came into existence. I don't say that the triage, as it was used in 1940s in World War II, has to be implemented in the same spirit. What I say that there should be a modified form of a triage in order to put the attention on these two high risk groups of population. That's my point.
All right. Do you think that our wearing of masks, staying inside our houses, and all that will eventually cause coronavirus to go away?
Well, coronavirus is not going to go away like this because you are just wearing a mask and corona is going to just leave the environment. No, it doesn't happen that way. The mask is a barrier to protect a person from getting infected
Mm-hmm.
and to protect or to sort of stop a person from infecting other person
All right.
who comes in the vicinity of the infected person.
Mm-hmm.
So it can be implied, the inference out of this is that the patients who are already infected or who are suspected because of the history or because of the travel history or other things, who are suspected to have been infected or who are under quarantine,
Mm-hmm.
they should wear the masks in order not to infect the people who come
Never.
near them. That's very important point. And another point is that this high risk population group, which I already mentioned, old people, elderly people, or these senior citizens, whenever they have a chance
Mm-hmm.
to come in contact with a person who comes from outside, they should they should have some type of a mask in order to put a barrier between the person who is coming in inside the house or inside their room and themselves.
All
This is a precaution, but it does not kick away the virus from the environment. No, it
right.
doesn't. Virus is there.
All right.
What the mask is used for is to just to protect your airway from getting a heavy dose or heavy inoculation of the virus.
All right.
That's it.
So it's not going to just end the whole
No,
epidemic.
no, it is not. It's not for that. It's not ending. It is a measure which helps to sort of what you can say, restrict the or sort of decrease the amount of the virus
Mm-hmm.
which without a barrier is likely to, I mean, get inoculated on the surfaces, nose, mouth, and other things.
So if we don't like go to eradicate the, how is it basically going to end? I mean, there has to be a way so that this COVID-19 will end. I mean, um, wearing masks and washing hands, maintaining
This is a
hygiene,
good question.
that is just going to like, if you just stop doing that, the virus is going to come again, right?
Yes, that is a theoretical possibility. What happens actually in these viral diseases is, especially in the epidemics, is that these type of measures, yes, they prevent, they help the people uh, to not get sick.
All right.
They help the people, we can say, a big chunk of people to not get sick, but it does not
Mm-hmm.
somehow help. I mean, it's not shown that it helps in stopping the epidemic the way we construe into it.
All right. So.
Actually, what happens? Every single person gets infected, and there is a basic minimum
Mm-hmm.
infection which should be in the community
Mm-hmm.
in order for the epidemic of such scale to be wane off.
Mm-hmm.
So, in case of these viral diseases, 70% of the population of a place
Mm-hmm.
or a country
Mm-hmm.
or we can say the world
Mm-hmm.
should eventually get infected in order for this epidemic to wane, because there should be an immunity in 70% of the, at least minimum 70% of the
All
population.
right. Okay, thank you for the answer. Um, Now the next question is, what is the role of temperature or seasonal variations in this case? Are the people, for example, of let's say Africa, more likely to get affected by coronavirus or less likely to get affected by coronavirus due to temperature than the people in Kashmir?
No, actually, it's very difficult as of now to see to have a final word on that. But if we look at the scenario,
Mm-hmm.
there seems to be some correlation uh, between the temperature and the virulence of the virus. Usually, these type of viruses, respiratory tract viruses, usually they follow a seasonal pattern. And if we look at this virus, we find that in southern part of the country, there is not that much incidence, especially in Tamil Nadu. There is not that much incidence of the cases as is found in the northern part of the country.
Mm-hmm.
Now, as far as Kashmir is concerned, we are unfortunately we have still a spell of bad weather, cool weather here. And if you look at the character of other viruses
Mm-hmm.
and at the way the other viruses behave and have been behaving, just like flu epidemics or other epidemics, so one can fairly guess that there also is a sort of a relationship between the weather and the climate, ambient temperature, and this virus, right? Because it has been seen that this virus cannot resist temperatures, higher temperatures, and it cannot resist the dry weather, and it cannot resist the low humidity in the atmosphere. So these are the things which are there, which have been found to have an impact on the survival of the virus. So I think then it can be extrapolated uh, in a way to say that yes, there must be some weather pattern in this epidemic. Yes.
All right. So, do you think that the infected patients, um, those patients who are infected with coronavirus, have any chance to recover from this disease? Has their recovering something to do with treatment? Is there any specific treatment for it?
Yes, there are people are recovering from this disease. There is not. See, we have to understand these things. Specific treatments